You're giving me a million reasons to quit the show. You're giving me a million reasons. Give me a million reasons. Giving me a million reasons. About a million reasons. If I had a highway, I would run for the hills. If you could find a driveway.
Just this week, Lady Gaga announced that she was in the hospital dealing with fibromyalgia. It's a chronic pain disease that affects more than 5 million Americans, mostly women. For Grace is a nonprofit that fights to help women who suffer from chronic pain. The group's founder, Cynthia Toussaint, was an accomplished ballet dancer when chronic pain ended her career, and she joins us live this morning. Welcome, Cynthia. Thank you so much for being here.
Thank you, Serena. It's such a pleasure to be here. Thank you for having me.
It. So you were diagnosed with, I want to get this right, complex regional pain syndrome.
First try. I'm so impressed. It was 35 years ago.
Oh my gosh.
I was a ballerina, singer, and actor, and I just landed a part on the TV show Fame when a minor ballet injury triggered complex regional pain syndrome. And because the doctors told me that it was all in my head for the first 13 and a half years of my illness, I was left bedridden for a decade, and I couldn't speak for 5 of those years while the disease spread throughout my entire body and ravaged my vocal cords. So I'm so happy that Lady Gaga is speaking out about her pain, because it's been so taboo to talk about pain. We can't get hired, if we have pain because we're unreliable. There's such a stigma.
So what is complex regional pain syndrome exactly? I'd never heard of it before. Many of us have heard about fibromyalgia, but what is that?
Exactly. And I have fibromyalgia too. We tend to collect these autoimmune diseases. I have 12 of them now, very polychronic. Yes, actually it starts with some kind of injury, trauma to the body, and then the central nervous system sends a message to the brain that says we have pain. But with CRPS, for some reason, that signal doesn't know how to shut off, and it continues to amplify. So it's like pain, pain, pain. And then it gets bigger, the pain gets worse when but the injury is getting better, and then those neurons start sharing messages with other neurons. So that's how the disease starts to spread. So we need to be caught and treated very early and very aggressively. With CRPS, we need to really be treated within the first 6 months to get a cure and to walk away from this horrific, catastrophic disease.
And Cynthia, as you mentioned, you were later diagnosed with a litwery of other diseases and conditions. How are you dealing with all of those now and managing your pain?
Well, actually, I do it through integrative care. We're really big at For Grace with the National Pain Strategy. The NIH wrote a strategy, and it's really addressing all of the problems. It's talking about the 100 million people in the United States who have chronic pain. This is a healthcare crisis, in my opinion, the biggest healthcare crisis we have in this country. The #1 reason people go to the doctor is because of pain, yet doctors don't really know what pain is, and they don't know that pain, if it's not acute anymore, it becomes a disease. Like what I have, I don't have a symptom to an underlying problem. Take care of the problem, the pain will go away. I have a disease, and so we have to take pain seriously. We have to get educated. We need to educate people in medical schools, doctors, the general public. Our families tend to walk away from us when we have pain because we're not believed, and doctors tell us that we're crazy, especially if we're women. There are these biases, gender bias, and so women hurt more and are helped less, and we need to change that.
So is it a combination of diet plus modern medicine, you think, that is really the key? It's a comprehensive or holistic picture?
Yes, everybody's different. For me, medication got me out of bed after 10 years, and then a lot of self-care. I do acupuncture. I do mindfulness meditation every day. I never thought that could help me, but it does. Actually, following our passions is very important. Narrative therapy was very important for me. I wrote my book with my partner of 37 years. It was like incredible couples therapy, and I was able to purge and exercise so much of my pain and sorrow, and I got a lot better, and I started swimming a mile in a day like I used to do. So it's amazing. I can't walk half a block, but I can swim a mile. We can all keep moving. And if I had never stopped moving, I would never be I wouldn't be using a wheelchair today.
Well, you've become such an amazing advocate, I know,
Thank you.
using your experience to fight for change in the government.
Exactly.
But also hosting this event this weekend.
Yes.
It starts on Friday. Tell us about that.
It does. We're hosting a Change Agent Summit in 2 parts, and it's a pain summit, and our goal is to implement the National Pain Strategy that was developed by the NIH in California, and we're going to do that by bringing thought leaders from all of the different sectors of the healthcare systems together, and we want them to think deeply about barriers to care and possible solutions, and then work together to improve pain care in California. And then, because we want to make sure that people in pain and their caregivers have a voice, on Friday September 23rd, we're going to convene those people in downtown Los Angeles, and the day is all about us having a voice and being sure that collectively our voice is being heard, so that all of us with a stake in pain care are working together to make big change in California. And we are going to implement the national pain strategy, and then we're going to be a model for the rest of the country and
Wonderful.
make big change. So that's a good news.
Thank you so much.
Thank you for
Cynthia.
having me.
Yeah, we really
Serene.
appreciate it. Good luck
My
with the
pleasure.
event.
Thank you.
There are still seats open at the Change Agent Pain Summit. It's Friday at 8:30 at California Endowment's Center for Health Communities. For more information, just go to our website, cbsla.com. Amy?
Thanks, Serene. Well,